Hello, listeners. Welcome to Crack the Wellness Code podcast, a space where we discuss all things health and wellness. This podcast aims to educate, inspire, empower, and impact, thereby leaving you feeling uplifted. Happy listening.
So let's talk about pain. Pain can have purpose also. It alerts us if we have strained or injured a body part. But if it lasts for longer time, for a few weeks or months, it can lead to suffering. And the problem with pain is it can affect our mood also. So let's talk about non-invasive techniques. So ideally, it would help to see a doctor first and then see a physical therapist or an occupational therapist. So they can give you a customized exercise program because there are no one-size-fits-all treatments because there are so many diagnoses. I see a lot of patients with hand arthritis and carpal tunnel, but I don't even treat two patients with the diagnosis of carpal tunnel the same way. So it is good to see an expert. Now let's talk about exercise. Motion, the biggest mantra for you is motion is lotion. A lot of times when someone's body part gets injured, the tendency is to not move it. If a knee is injured or an elbow is injured, because we try to protect that body part, and that makes that joint, it can make that joint go stiffer and leading to more pain. A good, easy things available at home could be a heat pack or a cold pack. If a heating pad does not help you, you can follow the recommendations on the packet of the heat pack. Your physical therapist can recommend other versions of the treatment, like TENS unit and things like that. Posture is huge, especially during this quarantine time. If you are using the computer more than usual, and even your posture throughout the day, no matter what you are doing, whether you're cooking, cleaning the house, please be mindful of your posture. Make sure the height of your desktop monitor is adjusted so the top line of the monitor is at eye level. You can also use ergonomic keyboards to reduce strain on your wrist. For hand pain, you can also use adaptive equipment or an orthosis like jar openers. We also, as therapists, we also recommend splints or braces for hands, which are again very specialized and very customized depending on the need and the very specific diagnosis of the patient. I do not give two exact same splints to a patient. With the same diagnosis, for example, carpal tunnel or arthritis of the hand, we dive deep as to what exactly the deeper cause is. Joint protection techniques. Use your joints in optimal positions. Please do not text with your thumbs. I keep reminding my daughter. And try to hold your smartphones at eye level so you do not strain your neck. Generalized relaxation can also help reduce the perception of our pain. So let's say if I'm having severe pain, if I'm relaxed, I may perceive it to be moderate. Or let's say if I'm having mild pain, if I'm very, very stressed, I can perceive it to be moderate level pain or even severe pain. So if someone is in pain, in addition to all the medicines and therapies, trying to practice deep breathing, meditation, mindfulness, or listening to soothing music, anything that you find relaxing can help. Let's talk about massage. Touch signals travel faster to the brain than pain signals. So rubbing a body part can also help. Let's say if your knee or your elbow is hurting, so just rubbing, if you rub that part, uh, those touch signals are traveling to the brain faster, blocking the pain signals, and they can take the edge off the pain. They will not really help take the pain away completely.
That wraps up today's edition of Crack the Wellness Code podcast. If you want to know more about this episode and many such archive treasures, then make sure you download our CWC Kushi app, available both in app and Play Store. Thank you for listening.